Ear injuries are very common in Jiu Jitsu, and I want to make a quick video discussing them. The auricle, this portion of the ear, is composed of 3 layers of tissue. The innermost layer is the cartilage, a rubbery tissue responsible for the shape of the auricle. It lacks a blood supply and is unable to heal itself. The second layer of tissue is the perichondrium, which is like a piece of cellophane on top of the cartilage. This does have a robust blood supply and is responsible for bringing oxygen and nutrients to the cartilage to keep it healthy. And then the third layer of the auricle is the skin, which is easily visible. The purpose of the auricle is to effectively funnel sound waves through the auditory canal, the ear canal, to the tympanic membrane, the eardrum, so that we can maximize the sounds we hear in the environment. A very common ear injury in Jiu Jitsu is a contusion. Blunt force trauma can cause small blood vessels to burst, giving it a purplish appearance and a little bit of swelling. This can easily be managed with rest, icing, and non-steroidals. A second type of ear injury in Jiu Jitsu would be an abrasion or a scrape. Certainly washing the area 3 times a day with warm water and soap and applying Bactroban ointment twice daily until it's healed is an effective treatment plan. Another possibility is a laceration or a cut. This is a little bit more serious, and you will notice bleeding immediately at the academy. If the edges of the laceration are easily pulled apart, or they're gaping, or you can see yellow cartilage clearly visible, it is advisable to go to the nearest immediate care or emergency room for proper cleaning of the lesion, possible skin adhesive applied like Dermabond, or fine sutures. An auricular hematoma or cauliflower ear, you'll take a trauma and there will be a collection of blood that builds up localized in one portion of the auricle. What happens here is the perichondrium, which has a robust blood supply, is peeled off of the cartilage, and blood collects in that potential space and the space between the cartilage and the perichondrium. The problem is, because cartilage lacks a blood supply, it is unable to resorb blood and help do its part to heal with the perichondrium and come together. Many times we've all seen in a Jiu-Jitsu academy where an auricular hematoma, a collection of blood, is drained with a needle-on syringe by a teammate. However, usually you need to have some type of an open incision to allow drainage, because once that potential space is opened up, blood recollects, or serous fluid, which is another type of fluid, collects. Over time, a soapy-like calcium deposits there to replace the blood, and that gives you the characteristic deformity of the certain areas of the auricle, thickening, and over time it can pull the edges together, giving a thickened appearance and a mal-shaped appearance. One may say cauliflower ear is pretty cool. What's the problem? The problem is, of course, we mentioned that the main function of the auricle is to effectively funnel sound waves to the eardrum. Over time, if you have a smaller opening at that distal auditory canal, the outside part of the ear canal, that can diminish the quality and quantity of sound waves that make it to the tympanic membrane, the eardrum. And it may diminish your hearing. Or if you produce excessive cerumen, if you're an excessive wax producer, imagine a provider trying to flush out your ear canal when the cauliflower ear makes it extremely difficult to do this. If you develop an auricular hematoma, a collection of blood anywhere on the auricle, it is advisable to make an appointment with an ear, nose, and throat physician as soon as possible for proper management. There are advanced surgical techniques that can be performed in the office, which will significantly increase the chances of the cartilage and perichondrium coming back together to seal that potential space and give you a better cosmetic effect.